Drug abuse and related issues like crime, violence, and family disruptions are rising in our community, particularly among youth and vulnerable populations. This crisis has significant social, economic, and public health impacts, including increased crime, higher healthcare costs, and destabilized neighborhoods. To address these challenges, a comprehensive community-based intervention plan is needed, focusing prevention, law enforcement, treatment, and community education. A coordinated approach involving local government, law enforcement, healthcare providers, schools, and residents will help reduce drug abuse, prevent vice activities, and support those affected by addiction. Current state of drug abuse in the community. Understanding the current state of drug abuse and vice activities in the community is critical to developing effective interventions. Data from local law enforcement agencies, healthcare facilities, and community organizations highlights the following key trends. Prevalence of opioid abuse. The community has seen significant increase in opioid abuse, particularly with heroin and fentanyl. Over the past 2 years, opioid-related overdoses have increased by 40% with a growing number of fatalities. Methamphetamine use. Methamphetamine use is also on the rise, especially among young adults and those in low-income areas. This drug is linked to violent crime and has been identified as a significant contributor to homelessness and social instability. Youth involvement. Data from local schools indicated substance use among high school students has risen by 15%, with alcohol, marijuana, and prescription drugs being the most commonly abused substances. Drug-related crime. There has been a notable increase in drug-related crimes, including possession, distribution, and trafficking. The local police have reported a 20% increase in arrests related to drug offenses over the past year. Current intervention programs include drug treatment centers, harm reduction programs, and outreach efforts. But these initiatives are often underfunded, fragmented, and lack sufficient coordination.
Key stakeholders and resources. The success of the intervention plan will depend on the active involvement of a variety of stakeholders and available resources. This includes local law enforcement, police departments, and community policing unit that can help enforce drug laws and collaborative with other services. Healthcare providers, local hospitals, addiction treatment centers, mental health professionals, and counselors who offer treatment and support services. Schools and educational institutions, schools that can implement prevention program and offer support for at-risk youth, community organizations, NGOs, religious groups, and local organizations that engage in prevention, outreach, and rehabilitation efforts. Local government, city or county officers, officials who can allocate funding, support policies, and ensure effective coordination among stakeholders. Prevention strategies. Preventing drug abuse, especially among youth, is critical to addressing the root causes of this issue. The following strategies are proposed. Public awareness campaigns. A community-wide public awareness campaign will be launched to educate residents about the dangers of drug abuse and provide information on available prevention and treatment resources. This campaign will use social media, radio, television, posters, and billboards to spread key messages about the risk of drug use and encourage healthy behaviors. School-based drug prevention programs. Schools will implement evidence-based drug prevention programs that focus on building emotional resilience, coping skills, and peer pressure resistance among students. Programs like DARE, drug abuse resistance education and life skills training are proven to reduce substance use. Workshop will also be held for parents, teaching them how to identify early signs of drugs abuse in their children and how to engage in meaningful conversations about drugs. Community outreach initiates will be developed to engage at-risk youth and families. This could involve mentorship programs, youth clubs, sports leagues, and other extracurricular activities that provides positive alternatives to drug use. Partnership with local businesses, schools, and faith-based organizations can help build a network of support.
Strengthening law enforcement efforts. Law enforcement play a significant role in reducing drug abuse and vice activities. The following measures will be taken to strengthen local law enforcement efforts. First is community policing and collaboration. Community policing initiative will be expanded, which encourage police officers to build trust and rapport with residents in high-risk neighborhoods. This collaborative approach helps identify drug hotspots and provide early intervention opportunities. Officers will be trained in de-escalation techniques and how to recognize signs of drug abuse or tracking. Second is use of technology and data. The use of technology, such as surveillance, cameras, and data-sharing platforms, will be increased to detect and prevent drug-related crimes. Predictive policing tools can help identify emerging drug hotspots, enabling law enforcement to allocate resources effectively. Third is the partnership with healthcare providers. Local police will collaborate with healthcare providers to ensure individuals arrested for drug-related offense are referred to appropriate addiction treatment services. This holistic approach aims to break the cycle of criminal behavior and address the root causes of addiction.
Researching treatment and rehabilitation services. Effective treatment and rehabilitation programs are essential to helping individuals recover from drug addiction. The following approaches are purpose. Expansion of treatment centers. We purpose expanding the number and capacity of both inpatient and outpatient treatment centers. These centers will offer detoxification, counseling, and rehabilitation services, particularly for individuals addicted to opioids and methamphetamines. Expanding access to treatment can help reduce and streamline emergency services and prevent the spread of drug-resistant disease. Medication-assisted treatment or MAT. MAT is a proven method for treating opioid addiction and should be more widely available in local treatment centers. MAT combines medication such as methadone or buprenorphine with counseling and therapy to reduce cravings and support long-term recovery. Rehabilitation and reintegration programs. Rehabilitation should not end with treatment. Aftercare programs will be developed to provide ongoing support, including vocational training, housing assistance, and mental health services. Peer support groups will be encouraged to help individuals stay connected and maintain sobriety. These programs should focus on helping individuals reintegrate into social and rebuild their life after addiction.
Community education and engagement. Educating the community about the dangers of drug abuse and encouraging participation in prevention efforts is essential. So the following initiatives will be implemented. First is the community workshops and events. Regular workshops and seminars will be held to educate the public about the dangers of drug abuse and how they can help prevent it. These workshops will cover topics like recognizing signs of addictions, how to support loved ones, and available local resources for treatment. Second is the volunteer networks. So a volunteer network will be established to engage residents in drug prevention and recovery efforts. Volunteers can assist with community outreach programs, mentor at-risk youth, or provide support for individuals in recovery. Third is the partnerships with local businesses. Local businesses can play a significant role in drug prevention by supporting educational initiatives, promoting a drug-free workplace, and providing resources for employees struggling with addiction. So, businesses can also contribute finding or local resources to local treatment programs. And now let's go to the conclusion. Therefore, the goal of this all-encompassing community-based intervention plan is to use prevention, therapy, law enforcement, and community education to address the problem of drug misuse and vice behaviors. Drug misuse can be less common, those impacted can receive support, and a safer, healthier community can be created by concentrating on these four important areas and encouraging cooperation among local stakeholders: law enforcement, medical professionals, educational institution, neighborhood association, and locals must all activity participated in order for this strategy to be implemented successfully. We can strengthen our community's foundation for the future by working together to battle drug usage and issues that go along with it.